Thank you very much. It's always a pleasure to take part in discussions like this, and especially I look forward to this meeting in this building, also due to the perspectives that you have with your ongoing work with making a reform on how to use healthcare data here in Switzerland. I'm the CEO of the Danish eHealth portal. I was first man in charge 25 years ago. So yes, there have been some successes, but there's also been a lot of failures. And I would like to share those failures with you if you're interested. As Felix mentioned, both last night took part in a very interesting meeting in Copenhagen at Vive at the 6th of December last year. And we had very, very good discussions with Andreas Faller and the very competent Swiss delegation, and thank you very much for that. Before that, my dialogue with Switzerland goes way back, and today I will recall that in 2017 and 2018 we received Swiss delegations, and at the end of the year I was invited to speak at the Health Conference 2018 in Bürgenstock Resort, a very, very beautiful resort. And after the COVID pandemic, I was invited as a speaker at the FMC National Symposium here in Bern at the casino. I've just seen the building again yesterday. And especially, I'll pinpoint what I learned about Swiss motivation for change at those two occasions in 2018 and 2022, because I had to ask myself how burning the burning platform really is. And I look forward to have an update of the implementation of the electronic health record or patient dossier, as you call it here in Switzerland, and what's going on with the work of legislation and health for the time being. The reason for my focus of how burning the platform really is that back in 2018, as part of my visit in Bürgenstock Resort, I saw an interesting 5-minute report at Swiss television, SRF TV news broadcast, Swiss going nationwide with electronic health record or patient dossier. The report was initiated with a statement that Switzerland normally sees itself as role model, but not when it comes to EHR. The TV presenter, and I saw him yesterday night, he's still there, but a little more gray now. He says that if you were Danish, you would have access to your electronic health record, and the healthcare professionals would always have access to your updated personal clinical data. And the reporter shows that in Switzerland, the patient record pile looks like this pile of paper, at the time being, but that you now start implementing. It was first in Basel and Geneva, and then in only 2 years it would be nationwide, he claimed. Since then, I've been following the work of implementation here in Switzerland on the side, and also in 2022 at the FMC National Symposium. And to be honest, there has been no big change in the status of implementation, and especially I felt no burning platform, either in 2022. Afterwards, I had a breakout session during lunch, and again, I felt no burning platform. But as I understand Andreas and Felix, things are changing, but I'm sure we will have to discuss this. Yeah. But for now, let's go on with the agenda for today, and to support your work, I'll concentrate on our solutions and introduce to our two platforms, our web portal and our health app called My Health. Throughout my presentation, I'll refer to our solutions as Sundhed. It's the Danish word for Gesundheit or health. So yeah, it's nearly the same word in German and Danish. First, we will have a look at the universe of Sundhed, what our digital solutions offer. After that, I'll shortly go through Sundhed as an organization, our strategic anchoring and so on. Then I will reflect on our user-centered approach and address Sundhed and My Health also in an international perspective. And maybe you already know that the Danish healthcare system is universal. It's based on the principles of free and equal access to healthcare for citizens, and also sundhed is free of charge. Also, we have a long tradition for registration and have been collecting data from electronic health record systems in everyday work, and also national registers for more than 40 years. And this means that we have exceptionally reliable health data covering the entire population from cradle to grave. Also, you have to know that we have a national security model for a secure logged-in. It's based on the Danish unique personal identifier, which all Danes have. This national solution called My ID ensures secure login to all public services in Denmark, including sundhed, and also many private services such as banking and insurance services and so on. So now let's move on to the solutions. Here you have a glimpse at our web portal, sundhed, and our app, My Health. And 96% of the population knows sundhed in Denmark. And last year we had 55 million visits across our two platforms. That's a lot. You know, we're only 6 million people. Our solutions is for citizens and for health professionals. And sundhed was launched back in 2003, as already mentioned. So that's more than 20 years ago. So there's a lot of maturity also among the users and among the organizations working with these services. At sundhed, you can access a lot of highly qualified health information written by health professionals and the Danish health record, which give access to your electronic health records notes, your medicine overview, your vaccinations, your lab responses, and also your appointment with the healthcare sector, just to mention some. And you can also give authorization to a relative or to a trusted person to access your personal data. So you can give access to one of your elderly parents. If you're 50 years old, then you can help your father who's maybe 80 years. Or you can access the data of your minor children. So this possibility to give a helping hand to relatives in a digital way really gives patient empowerment a new dimension. Think about your own feelings if you have an old parent 200 kilometers away. Now you can help him with the appointments, explaining what is in the EHR and so on. On the top of sundhed, we have developed the app My Health. It's a slimmer, it's more user-friendly version of the portal for the citizens. And especially lab responses, as we already have seen on last slide, it became very important during COVID-19 pandemic. And we already had all the necessary building blocks to fast and easy develop the Corona passport in Denmark. It actually played a crucial role in reopening society after shutdown. And I'm pinpointing this because you can then have a broader discussion here in Switzerland. I'm pinpointing this because the value of having a national infrastructure in the case of crisis due to pandemic, due to war, or due to climate, and unfortunately, we have those cases today. With those two platforms, we had a very good starting point when Corona spread to Denmark, and the Corona passport gave a lot of international focus, and among others from German medias like RTL, Euronews, ARD1, das erste, glaube ich, yeah. And I'm sure that you feel comfortable with German language, and though this little clip is not brand new, I'll show it to you because then you, in German language, have a entrance to our universe.
Dänemark ist, was die Digitalisierung betrifft, in vielen Punkten schon lange viel weiter als Deutschland. Es lohnt sich also ein Blick auf den Impfpass digital bei unseren Nachbarn.
Das ist die App, die in Dänemark seit Wochen Corona-Lockerungen möglich macht. In einer Art digitaler Krankenakte sind hier alle Patientendaten gespeichert, auch die von Venja Beusen. Die App gibt es schon lange. Jeder Arztbericht, jedes Rezept ist hier dokumentiert. Und nun eben auch ihr Corona-Status. Die App öffnet Türen, zum Beispiel zu diesem Restaurant in Kopenhagen. Wer hier essen will, braucht eine Reservierung und den digitalen Corona-Pass. Jeder Gast muss belegen, dass er entweder geimpft ist oder ein negatives Testergebnis vorlegen. Das klappt meistens, auch wenn es manchmal noch holpert. Es ist ja wichtig, dass sich jeder Bürger sicher sein kann, dass er auf die eigenen Daten zugreift. Und das wird durch das Personenregister und durch eine Login-Lösung garantiert. Auch die Mitarbeiter des Gesundheitswesens können so verifizieren, dass sie es mit der richtigen Person zu tun haben.
Yes, it still makes me happy when I see how happy the Danes were about this Corona passport. Reopening society as first country, I think, worldwide. Now let's have a look at the Danish health record at Sundhed. Sundhed is, as mentioned, for citizens and for health professionals. They have access to exactly the same information. It's just accessed through different user interfaces. This one is for citizens, and as you see, you have access to your medical records, your lab responses, your description of x-rays, your medicine record, vaccination, and health appointment overview, and so forth. And due to a system integration, health professionals access Sundhed directly from their daily EHR system. So if you have Epic or whatever, you have a button. And using that button, you have this record for the person you have in front of you, using the CPR number. It's fast, it's easy, and it's secure. And this is how it looks for the health professionals. This one is just to illustrate the different user groups accessing Sundhed and how Sundhed and Danish health record integrates into national databases and into local systems. And if you look at the dark blue ones at the bottom, we integrate to more than 170 data sources, and we look up and we display existing data. So data is collected and stored in local, in regional, and in national databases and EHR systems in the healthcare sector. And they are not stored at Sundhed. There's no duplication. So we only integrate, display, and reuse the data that are made on beforehand. That's also why it's relatively cheap. Data are there on beforehand, not made for us specially. With Sundhed, health professionals are provided with the possibility to access patient health data from other systems across the sectors and across the boundaries. And in this way, Sundhed is also a sort of national electronic health record in Denmark. It's covering all citizens. It's covering all healthcare organizations. And it's in every healthcare organization in Denmark. That's a strong one to have. And this is a very important step toward the patient-centered care and treatment in Denmark. And it's widely used. Last year we had more than, I think Lars mentioned that, 3.2 million lookups from Sundhed health professionals directly from their local systems. So this illustrates the needs that in 3.2 million cases, it was interesting to look outside the boundaries to have enough information about the patient you had in front of you. And you can see 1.4 million is from hospitals and 1.7 is from general practitioners. A new group of users is those from the municipalities, and that number is really rising. We have, with Medcom, we have put the bottom also in the municipalities. Really steep slope on that traffic also. And you can see it's important, you can see the quote from the doctor out there. It's really important for them. Yeah. So hopefully this has provided you with some insight about our solutions. So now I've had a little look behind our organization and our governance. And first, Sundhed is a cooperation between the 5 Danish regions, the state, and the 98 municipalities. And the financing comes from there and basically by taxes. So same kind of organization as Medcom. Our organization has since beginning and is until the end of this year still governed by its own political appointed board with elected politicians. Afterwards, we are, due to a health reform, changing the organization and the governance for Sundhed, Medcom, and others, and more about that if you want to discuss it afterwards, if you can use that kind of experience also. This dimension about democracy, health IT in general, is very important when we talk about confidence and access to and sharing clinical data, because it's a model that ensures that data is handled within a democratic setting and that data is owned and used by the general public and nobody else. This is not Amazon, this is not Google, this is the Danish healthcare portal. It's so important for the confidence, and later on I will put a few words. We can take it now, because it's also important to add that Sundhed was, as mentioned, launched in 2003. So maturity also among users is very high, and they feel actually empowered. And they have this culture of trust, and they find that sharing data is good for themselves, and it's good for the greater good. So maybe we have a difference between Switzerland and Denmark, which we can discuss afterwards. You are rich, you are so advanced in technological base, so you can do everything you want in Switzerland. But there's something which is about culture trust, which is maybe a little different. So if you want to go into a deep dive, let's do that. Sundhed and My Health have been built up step by step during the years, and it's not a big bang. And this is also to stress that digitalization takes time. We've come a long way due to hard work and negotiations with our stakeholders. Another important dimension is our anchoring in the national strategies. Lars has already mentioned it. It's so important that somebody writes the book for you. And in the national strategy, you can read that even more health data should be accessible for citizens, for relatives, and for health professionals as Sundhed. So it places Sundhed in an even stronger position with the healthcare sector in the Danish healthcare infrastructure. And with our board leading the way, we also have our own strategy with our own vision. And it is to be, they ask us to be a user-centered health universe, creating value and coherence for both health professionals and citizens, and to support the empowerment of the citizens. It's a result, making this strategy, and now again I'm leading to the presentation from Lars, is a result of a long, intense dialogue with our stakeholders, the healthcare professionals, the patients' associations, the IT industry, and others, to discuss the direction and the content of the new strategy. Actually, it took 1.5 years to write only 24 pages. So this strategy process is also how we run this business. Okay, but to be this user-centered universe, we obviously have to know our users and get them involved in our development. And so we're doing a lot of data collection to know our users. And we have established what we call our Sundhed user panel. We have more than 2,700 citizens and healthcare professionals take part in dialogue when we develop new services or we maybe have a campaign, then we ask them on beforehand. This one is also to illustrate that we have a user-centered approach through a method called Think Loud Test. And it's direct observation when users are asked to complete different tasks. So we analyze the results, so we make new designs. That could be navigation, change of colors, and so on. And it's all about saving time and keep it simple for the users. And we know that simplicity is also the best way to make digital inclusion happen. So you know the 20% who are not that digital able. We have to help them with simplicity, but at the same time we help ourselves also. So if Sundhed and My Health are easy and fast to use, people feel secure, they feel safe, they feel more empowered. And I think then they are able to take care of themselves in a better way. Okay, now you have, I hope, an idea of Sundhed and the solution and the approach that we have. Recently, as Lars mentioned, Danish government announced a political agreement on a healthcare reform, which is a response to the emerging challenges of growing elderly population, increase in patients with chronic diseases, and lack of healthcare professionals. The reform is an effort to move the focus and the resources from the hospitals and specialized care towards primary, towards digital, and towards home-based care. And Sundhed plays a crucial role within this transformation, and Sundhed is already seen as a Danish digital front door, since we already provide the digital entrance to the healthcare system. But I'm sure there's a lot of, for instance, AI-based opportunities to be explored and to be developed and strengthen this position in the future and to support the ambitions in the healthcare reform. We have come a long way, but now we really have to step up. And I would just mention a few things from our work with stepping up. To do that, we will have to analyze how to and what to. And for the moment, we have two focus points. We have mental health and we have new technologies. I'll start with the new technologies. Like many others, we have an AI-based chatbot helping our users with simple questions. We have 58% of the traffic is through the chatbot. So using AI with our chatbot and combine it with our, I must say, brilliant medical handbook, we in this autumn is releasing a first version of a virtual assistant providing generative and specific answers to you. It could be your specific questions about disease, treatment, or symptoms related to your specific situation. But, and that's very, very important, it will not be treatment. If you need to be treated, you have to call your doctor, or you have to see a nurse or somebody else. You can also see this AI-based virtual assistant as a kind of self-service symptom checker for anyone to look to understand one's own symptoms and to explore potential causes or receive guidance to next step and so on, and to prepare for your next medical appointment. Because until now, and I stress this, AI is not doing the treatment. Our focus, as mentioned, is also on mental health, and within this, we'll provide more interactive tools for the citizens to handle one's own mental situation. We have, for example, learned that in our collaboration on establishing the self-help platform, we need to think in new colors, we need to think in new shapes, we need to have more humor. Our designers have therefore, with strong involvement from the future users in the target group, explored how to create a more welcoming and a more relevant offering. Here we need to move away from the classic red-white operating room or waiting room look, which we have at Sundhed, and includes a space in green and turquoise colors. And in this space, you're not necessarily a patient. Maybe you're a young person seeking advice and self-help tools in making, if you are going to manage inner restlessness, or if you are going to manage anxiety, for instance, before an exam. And all these digital front door initiatives make the healthcare sector more accessible, more helpful, and it will support even more empowerment to the citizens, to the patients, and to their relatives. But it will also, where also Lars has started his presentation, help ease the pressure on the health professionals and help them save time, both in the municipalities, at the GPs, and also in the hospital sector. So further development of Sundhed as a digital front door is a win-win for citizens and for society. And we need to accelerate this AI perspective to keep the leading digital position in the healthcare sector, also in an international perspective. Because according to this UN e-governance survey from 24. Denmark is world leading in e-government. And our digital portals and also Sundhed is explicit mentioned. We also had the same lead in the same survey in 2018, 2020, and 2022. So to be honest, we are leading in this way. And I'm showing you this because those benchmark reports is pinpointing the strategies for digital governance across sectors as a driver. And this is exactly what we have experienced. That's also Lars' story, what we have experienced in Denmark. So it's much more than IT developing and new technological solutions. Same high score we have in this OECD Health at a Glance from autumn 23, which is the newest one from them. The OECD organization is benchmarking because digitalization is such an important factor for economic growth. It's another perspective. If you want a society with economic growth, do digitalization, or you can fall behind. Especially Germany has a lot of attention to that from their government. The Danish digitalization gets international attention, and Sundhed is mentioned as a crucial part of this. This is not new. So I will end with a funny little story. It was an interview I gave to the Österreichische Rundfunk, or RF. I received the team in my office in Copenhagen, and they came to do interview and shoot videos for a special edition about the Austrian healthcare sector. And again, the German language from your neighbors in this little TV spot can maybe sum up about our solutions at Sundhed and my health. So here we go.
Gründe, warum Ärztinnen und Ärzte sich in Skandinavien wohler fühlen. Etwa neue Möglichkeiten zur Kommunikation mit Patienten und Kollegen. Ich bin in Kopenhagen, der Hauptstadt Dänemarks. Das Land gilt als Vorreiter in Sachen Digitalisierung. Mehr als ein Smartphone braucht man hier nicht mehr, um Bankgeschäfte, Behördengänge oder Arztbesuche zu organisieren. Inge Storm Andersen ist 68 Jahre alt. Sie ist seit einem Jahr in Pension. Grundsätzlich fit, aber ihre Lunge macht ihr hin und wieder Probleme. Ich treffe sie in einer Arztpraxis nahe Kopenhagen. Können Sie mir zeigen, wie Sie Ihre Gesundheitsdaten organisieren?
Ja, das ist die App, die ich am meisten benutze. Wenn ich etwa ein Rezept für ein Medikament bekomme, kann ich es hier sehen. Ich sehe auch, wie viele Medikamente ich noch übrig habe, und in der Apotheke kann ich das einfach herzeigen. Und die App ist besonders smart. Wenn mir ein Medikament ausgeht, schicke ich das einfach meinem Doktor. Er bekommt das digital und kann mir dann ein neues Rezept ausstellen.
Auch all ihre Arzttermine, Laborergebnisse und ihre gesamte Krankengeschichte kann Frau Andersen über die App abrufen. Bo Gandil Jakobsen ist Allgemeinmediziner. Auf Nachfrage bei der Patientin hat auch er Zugriff auf ihre Patientenakte.
Bevor die Patientin zu mir kommt, schaue ich in die Akte. Dort finde ich alle Informationen, etwa wenn sie in einem Spital war, alle Medikamente, alle Laboruntersuchungen. Wenn ein Patient also zu mir kommt, muss ich keine Zeit verschwenden für diese Dinge. Ich weiß bereits alles und kann mich um ihn kümmern. Das ist viel effizienter.
Die digitale Patientenakte wird in Dänemark von einer großen Mehrheit der Menschen verwendet. In Sachen Datenschutz ist das Vertrauen in staatliche Institutionen hoch. Das öffentlich finanzierte Gesundheitsportal Sundhed, in Österreich vergleichbar mit Elga, stellt die digitalen Angebote zur Verfügung.
Als wir vor 20 Jahren online gingen, gab es keine großen Diskussionen darüber. Es war wie eine stille Revolution. Die Dänen hatten aber auch vorher schon viel Vertrauen in staatliche Institutionen wie Krankenhäuser oder öffentliche Schulen. Dieses Vertrauen folgte einfach der Digitalisierung.
Heute sind die Softwareentwickler von Sundhed vor allem damit beschäftigt, die Daten ihrer User so benutzerfreundlich wie möglich aufzuarbeiten.
Wenn man etwa mehrere Bluttests hatte, kann man sich anschauen, wie sich die Ergebnisse über die Zeit verändert haben, ob sie besser oder schlechter wurden, und wir erklären den Usern auch, was all diese Nummern bedeuten. Normalerweise verstehen das nur Ärzte. Wir verbringen viel Zeit damit, die Gesundheitsinformationen für die normalen Menschen zu übersetzen.
The healthcare system to the normal citizen.
It is education and it is empowerment.
Es ist Bildung und Selbstermächtigung. Man ist damit auf Augenhöhe mit den Ärzten, weil man genau das Gleiche weiß wie sie.
As the healthcare professionals.
Und ich frage mich hier in Wien, warum klappt das eigentlich nicht bei uns? Die Pandemie hat uns ja allen vor Augen geführt, vor welchem Datensalat wir hier in Österreich eigentlich sitzen. Gesammelt.
Yeah, okay. With that one, you got a little insight in our company. We are 137 persons. We have between 50 and 60 IT developers, so we are actually an IT company. And then we also have all the user experience and everything. So we build Sundhed from the bottom, but we use the market very much. We buy standard components in the market, our CMS system, and if we need specialist developers, we hire them. So we have a rate of 70% in-house developers and 30% external developers to be on the edge of the market. That's how we combine it. Okay, that was all from me. Thank you very much for your attention.